Thank you for joining today. We're so glad that you all could take the time out of your day to be here for our webinar, Breaking Down Barriers, How Care Supports and Improves Specialty Care Access. My name is Tiffany. I will be the host for today. Specialty care today faces big challenges from long wait times and limited access to fragmented care delivery. In this session, we'll look at how AristaMD's care support helps support these issues by improving coordination, reducing barriers, and ensuring patients receive the right care at the right time. I am so thrilled to introduce our speaker, Cindy Craddock, registered nurse, director of operations here at AristaMD. Cindy will walk us through how care support empowers providers and patients with faster access, better outcomes, and lower costs. With that, let's get started, Cindy. I'll hand it over to you.
Thank you, Tiffany. Hi, everyone. Again, thanks for coming to join us today. My name is Cindy Craddock. I am the Director of Operations at AristaMD. I also oversee our care support team, which consists of nurse managers and care coordinators. And this team combines their clinical and operational experience together to assist in the specialty care access challenge. I've been a nurse for close to 28 years, so I've seen firsthand the access issues in regards to specialty care. I've been with AristaMD close to 9 years, and in that time, I've really had the opportunity of having a front row seat, if you will, to see the meaningful changes that we've created in specialty care access, as well as the improved patient outcomes. And during that time, I've also learned about all of the challenges that the different healthcare organizations face with regards to specialty care referrals, the understaffing, the high number of referrals, trying to close the loop on that. So we've really taken those challenges and implemented them in our offerings. And I'm excited to see our impact grow even more as we continue to broaden our offerings. During today's webinar, next slide, please. During today's webinar, we're going to start by examining today's specialty care challenges that are compromising patient health outcomes and impacting every stakeholder in healthcare. Next, we'll talk about true care support, what it looks like, and how it differs from the traditional referral management that you may know of today. We'll also detail the 3 fundamental functions that make care support effective. And then finally, we're going to show you the measurable impact that this approach delivers. Starting with the current specialty care crisis. So if you're not new to the healthcare industry, none of these will be surprising to you. Specialty care is expensive, it's timely, and it can be frustrating for all involved. There's the limited access, it's difficult to use, delayed access to care, limited time and resources. So all of these components together creates a cascade of problems. When specialty appointments aren't available within reasonable timeframes, patients either seek expensive out-of-network care or abandon the referral process entirely. So without that timely intervention, manageable conditions deteriorate into emergency. So it forces patients to seek costly emergency care instead of just things that could have been routinely addressed with specialty consultation. An example of this, a simple example, just to keep it very simple, is a rash. A patient has a rash, they go to see their PCP. The PCP isn't quite sure what it is or how to treat it, so they order a dermatology referral and go on about their day. That dermatology referral might sit in a queue for 7 to 10 days before a referral staff even gets to it, and then starts the process of trying to find a specialist at network that will see the patient and trying to see if the patient can get there and how much it costs. All of that, in the meantime, this rash is escalating. The patient's scratching, it then turns into a skin infection. The patient winds up in the ER. So very short example, but that's just a very day-to-day example of how this specialty care crisis can impact the patient. And this is when care support makes a difference. Next slide, please. So care support, what is care support and how does it impact this specialty care crisis? So care support transforms the traditional referral process from a handoff into active coordination. So instead of a provider simply ordering a referral and to a specialist and just hoping that they make it through the system, we provide end-to-end management. So we ensure every patient receives appropriate care in the right setting at the right time. So to refer back to the derm example, in that scenario, that's a simple situation. It's a rash that can be completed with an e-consult. So that patient could get care within 24 hours, close the loop. And that's just like the difference in knowing the right care at the right time for the right patient. And this involves 3 key components working together: care delivery, care support, and care design. So care delivery, matching the patients to the most appropriate care setting, like I just mentioned, whether that's a virtual care, an in-person visit, or through an e-consult. Care support, so helping guide the patient through that entire process, making sure that if it's a virtual visit, they know how to get logged in, that the specialist has all of the information they need before the patient gets there. And then care design, using clinical pathways and evidence-based interventions to just optimize the outcomes, all while controlling cost. And care support's built on 3 essential components. Oops. Sorry, going to the next slide. And we call these pillars, the 3 pillars of care coordination. So together, they address the healthcare inefficiency that we discussed earlier. So care coordination being first, this is all about creating that seamless pathway instead of separate healthcare silos. So we ensure the patients, again, get to the right care setting quickly, and we facilitate 2-way communication between the specialists and primary care providers. So referrals don't disappear into the black hole, if you will, and PCPs always know what happens with their patient. This happens more often than you might think, where the provider orders a referral and their job is done and they just assume the patient got to that appointment and got the care that they need. Oftentimes they don't know what that care was, and so it's very in separate silos, if you will, and this whole process streamlines it and puts it all together. Think of it kind of like air traffic control for healthcare. So we're making sure everyone gets where they need to go safely and efficiently. And then next up is health coaching. So this really transforms patients from being passive recipients, if you will, to actual active partners in their care. So we can provide personalized support for things such as nutrition, medication adherence, lifestyle changes. Our health coaches can help patients overcome any barriers they have to treatment adherence. So whether that's a cost concern, side effects, maybe it's a complex dosing schedule, or just simply forgetting to take the medication, we can provide practical problem-solving strategies that are tailored to each patient's unique challenges. So again, it's one thing to order a prescription and then have the patient come back in 3 months. But if the patient never fills that, or they fill it and they took it 2 days and they had a reaction, 3 months later they show up, guess what? Their blood pressure might still be high. And so we're basically implementing the coaching so that when they come back at that 3-month appointment, you can see effective changes. And then finally, the nurse management component. So our clinical oversight ensures
Cindy,
quality.
I think your camera came off.
Oh, did it? That's weird. Okay, 1 second. That's weird. It still shows that it's. I don't see your camera either. Oh, you're back.
Yeah, it's okay. I think we can continue without it.
Okay.
It might be from the system.
Okay, yeah, it still shows on for me, so apologies for that. Okay, nurse management. So that's the final pillar we're going to talk about. So our clinical oversight ensures quality and safety at every step. So our new nurses are using evidence-based protocols to guide care and decision. So it's a very systematic approach. We provide patient education and then optimize the care setting. So I know I've said this before, and I'll probably say it again before this is over, but making sure that the right care happens in the right place at the right time is very important. One example of this is a referral to the wrong specialty. So, and this might also happen more than you think. It's very easy in a drop down to specialties when a provider is really busy and they're taking care of their patient. Maybe they accidentally clicked ENT instead of endocrinology, which is right above it. So they select it, they fill out their chief complaint, they're putting their reason for referral, they send it, they go on about their day. the referral staff that might get to that referral, they may not be nurses or clinical people that know that, oh, that chief complaint doesn't make sense with that specialty. So they go along and start processing this referral, which at the end doesn't make sense. That delays the whole process, whether the patient actually winds up getting an appointment to the wrong office. Even if it's discovered before that, again, it slows the process. So in the instance of our care support, we would recognize ENT doesn't really make sense for this chief complaint. Let's either reach back out to the provider or just make sure it routes to the correct specialty. All right, now let's talk about how this is done. So these steps all work together to create a seamless journey. So compiling and reviewing patient history. So our nurse managers do all the heavy lifting in that situation. So they gather all the clinical context, the medical history, relevant tests, results, so that the specialist kind of receives everything one and done up front. So nothing's more frustrating than a patient getting to said appointment, whether it's a virtual or in person, and there's significant information that the specialist needs to do any sort of diagnosis or, treatment plan. So this is where the nurses kind of make sure that that's all done ahead of time, so the specialist has the best picture to be able to give recommendations. And then again, determining the best care setting. So not every specialty question actually needs an in-person visit to the specialist. And our clinical team will evaluate whether the case is appropriate for an e-consult, a video virtual consultation, or maybe they do need a traditional face-to-face appointment. Again, matching the setting to the clinical need. And then the coordination of treatment. So leveraging, again, our evidence-based protocols to ensure patients get optimal treatment pathways. So we guide patients through the whole sequence of care and the right providers, and again, making sure they know how to log in if it's a virtual appointment or what they need to do prior to the appointment. And then really importantly is facilitating follow-up. So that's where a lot of times the balls drop. You order all of the things, you told the patient, so you think we're good here. They already know what to do. But beyond the initial scheduling is actively following up to make sure the patient did attend that appointment that you made. That they did complete the recommended care, that they did fill their prescription, do the test that was ordered, really preventing any of them from falling through the cracks. Next is monitoring the patient progress. So again, our care support team can track medication refills, condition management, and patient compliance. So maybe we realize they didn't ever fill that prescription. They can be reached out to and see why. Was it too expensive? Were they not sure they were supposed to fill it? The list goes on and on for reasons on why patients do not follow through. And then finally, tracking and updating the record. So one thing we hear a lot of is, yes, the patient said they did go to a specialist, but what did they say? Nobody knows. The provider is kind of, again, working in his own silo, the PCP, where they don't know what's being done for the patient by the specialist. What medications are they on? This sometimes can then result in duplicate. So maybe they order the same prescription. The patient doesn't know they're the same. Maybe they ordered the same test that was already done. So we just ensure that the specialty consultations are communicated back to the primary care provider, completing the entire referral cycle, and just maintaining that care continuity so that providers, again, they don't have to wonder what actually happened to the referral that they ordered. This slide just kind of demonstrates how the nurse managers and care coordinators work together to kind of create that seamless patient experience while following clinical guidelines and kind of documentation standards. So in the first little box, you can just see it's kind of broke down to like what the nurse manager functions are and what the care coordinators. Again, it's all interactive and they work together as a team. And then the second component of this ecosystem is the follow-up care. So again, making sure that what the patient was supposed to do, they actually did, supporting them along the way, coaching, monitoring outcomes, etc. Now let's look at what happens when you implement the comprehensive care support. Next slide, please. So we'll start with the 80 to 90% referral completion. So the rate industry average of referrals is only 50%. So meaning half of all referrals never actually result in patient care. That's a pretty significant number. So that's providers ordering a lot of referrals, which is a lot of work, and then only half of them coming to fruition. So With care support, we nearly double the likelihood that the patient will actually receive some sort of specialty care that they need. And this isn't just an efficiency metric. So this represents patients who would otherwise fall through the cracks who are now able to get, life-changing care. And then next up is 65% decrease in referral leakage. So I like to equate this as us plugging the holes in the referral bucket. So the problem being the patient gets referred, but they never make it to the specialist. And so with us in there actively tracking and coordinating this care, we can ensure that patients don't get lost in the system. And then the relief to the provider is no more wondering again, like what happened to that patient that I referred. Next is 70% quicker access. So reducing specialist wait times by 70%. So what used to take weeks can now be done on average in days. Our smart triaging eliminates those typical delays. And then patients get answers and treatment when their conditions are still manageable, not when they become emergencies. So again, going back to the previous two examples, whether it started off as a simple rash that we could have remedied and closed the loop on within 24 hours, now has escalated into a skin infection and now emergency visits, and then, multiple medical problems, medications, cost, pain and suffering, all of that down the way. And then lastly, we have better medication adherence. So the health coaching really comes into play here, providing the ongoing support that makes the treatment plan successful. So you can make great treatment plans, you can order prescriptions, but actually implementing them is a lot of times the challenge. So just having the continuous guidance, support, follow-up, being readily available to patients to get them to continue their treatment plan. And then, of course, the cost impact. So again, better adherence means fewer hospitalizations. So again, back to that dermatology example, it's way cheaper to do an e-consult, have the patient take one prescription for the rash, have it heal, rather than letting it escalate into an emergency visit and multiple medications and follow-ups. So like to summarize that, when patients receive timely coordinated care with ongoing support, clinical outcomes just improve dramatically. So again, we're not just treating diseases faster, we're also just preventing further complications. This lowers the cost per patient, and then, happy providers, because they're also, their administrative burden is decreased by 50%. So care support, this is just kind of some key takeaways. All of these statistics are real patients receiving the care that they need, which is really the true measure of the impact and why we're passionate about what we do. So again, all these percentages are impressive on their own, but the real, end result is patient care. So this also translates to enabling primary care providers to do what they do best, and that's focus on clinical care rather than all of the additional administrative burden that the broken referral process causes. So our coordinated approach and care support really just enables healthcare organizations to operate more efficiently while also improving patient care quality. And that is the last slide. Does anyone have any questions that I can answer?
Thank you so much, Cindy, for sharing your insights today and walking us through how care support is transforming access to specialty care. Like Cindy said, we would love to open the floor for any questions. So please go ahead and submit them through the Q&A box. They'll go personally and directly to us, and we'll get to it as many as we can. Before we dive in, I just want to give a quick reminder that today's session has been recorded, and you will all receive a copy of the recording via email, so you can revisit the discussion or share it with any colleagues. We will make sure to get that out within the next couple of days. With that, let's get started with our first question that came in during the presentation. Cindy, how can organizations prevent unnecessary ER visits or hospitalizations tied to any delayed specialty care?
So that's a great question, and a lot of different ways, actually. So we have the proven care pathways that guide our nurses on referrals, such as things that could turn into ER visits. Again, I hate to keep beating a dead horse, referring back to like the simple rash, but that could be the same as for high blood pressure. So a perfect example of that is the patient comes in, the PCP, they've been trying to get their blood pressure under control for several visits. They've tweaked their medication and they're just like, I don't know what else to do here. I'm going to refer you to cardiology. So the provider's like, I've done what I can. I've ordered the referral. We're good here. Behind the scenes, unbeknownst to the provider and everyone else, it's weeks before the referral staff can get to that referral. In the meantime, the blood pressure is out of control. They're trying to find an in-network provider. Now they have an appointment scheduled, but it's 3 months away. So implementing our strategies, in that scenario, we could do a simple e-consult to start with, like, hey, maybe the patient does need to be seen eventually, but now within 24 hours, you have a new optimized medication treatment to get the patient stabilized to prevent those ER visits, even if eventually they do need to be seen in person. And in between that level of care would be like virtual care. So maybe it's a little bit more complicated than just an asynchronous consult, but we can get the patient virtually in with a cardiologist that can ask more questions and then really tailor that patient's medication treatment to really optimize their outcome.
Thank you so much for that answer. Our next question is, what approaches would you best recommend to support patients who struggle with managing chronic conditions?
So I think that's where our health coaching would come into play. So a lot of times it's not just one issue. Most patients these days have several comorbidities. And again, one of the main problems in specialty care now is, like I mentioned before, the different silos in care. So every specialist or PCP tends to kind of be in their own silo with the patient, but we all know all of those conditions interact with each other. And so having the kind of open communication for the PCP to see what all the specialists are doing for the patient, and then health coaching to help them manage all those conditions together and just make sure they're doing everything they should be doing, really will improve the outcome of all of those different comorbidities for patients.
Thank you, Cindy. And that actually goes in line with our third question, which would be, how important is health coaching and lifestyle support in improving long-term outcomes, especially with your patients with comorbidities?
I think it's instrumental in the outcome. Like I said, it's writing a prescription for a medication is a very small, although important, it's a very small piece of the puzzle. You have zero efficacy if you don't actually fill that prescription. And then even furthermore, if you don't take it correctly, if you run out, if there's gaps into filling it, if you take the prescription, but maybe you're not following the diet that needs to go along with that prescription. So health coaching is very, very important, and something that's often hard for these patients to get. They get the first portion, like, okay, here's your prescription, and they just feel like they're on their own. A lot of times they just give up. They're like, well, no one will answer my questions. I can't get an answer on this. I don't know what to do. And so they don't do anything. And then their condition escalates. And then we're back to square one, where they wind up in the emergency room. And it could have been simply remedied by having the coaching available for them.
Right. Thank you so much. And then our last question that we've gotten is, how can organizations keep patients from falling off after a referral is placed?
So that's something that our team is really in the weeds in, with these plugging the holes in the referral buckets, like I mentioned before. And to be honest, I've seen that. Again, I've been with Arista for almost 9 years, and I've been in referral queues a lot of my time with Arista. So I really have a really good behind the scenes advantage point of seeing how that happens. And it can happen quite easily if you don't, in the current referral process, without leveraging care support teams. And it's no fault of anyone, and it's never on purpose, but you have understaffed referral teams, over-ordered referrals, duplicate referrals. They just kind of bounce around from queue to queue because no one's really sure, especially if you just can't easily make an appointment. Okay, well, let's put it on hold and wait for a call back. And so, again, it happens a lot, but implementing our care support can really catch those that would otherwise be falling through the cracks, and just make sure that none of them do fall through the cracks.
Thank you, Cindy. And with that, we have concluded our Q&A session. So thank you again for sharing your expertise, and thank you all for joining us today. We hope that this session gave you a deeper understanding of how improving coordinated and support in specialty care can lead to faster access, better outcomes, and lower costs. As a reminder, you will all receive a copy of today's recording by email, so you can revisit the discussion or share it with colleagues who couldn't attend. And on behalf of the entire AristaMD team, we truly appreciate your time and engagement. We look forward to continuing the conversation and working together to break down barriers in specialty care. Have a great rest of your day. Thank you.